Anxiety and depression are common mental health disorders that affect millions of people worldwide. A research study found that half of the people with either depression or anxiety suffer from the other condition. Although both depression and anxiety have their own causes, they share many similar symptoms. Hello viewers, welcome to our video on overcoming anxiety and depression. In this video, we will provide practical tips and strategies that you can use to reduce symptoms and improve your overall mental well-being. Overcoming anxiety and depression. Mental health is essential, and it's crucial to take care of our minds just as we take care of our bodies. Anxiety and depression can impact anyone, and it's essential to learn ways to overcome them. Anxiety and depression are two of the most common mental health disorders in the world, affecting millions of people of all ages and backgrounds. They can be incredibly debilitating, causing symptoms such as sadness, worry, fear, panic, and hopelessness. While anxiety and depression can be treated, the road to recovery is often long and challenging. What is anxiety? Anxiety is a natural response to stress that can be beneficial in some situations. However, when anxiety becomes excessive or prolonged, it can interfere with daily activities and cause significant distress. Some common symptoms of anxiety include excessive worry, restlessness, irritability, muscle tension, and difficulty concentrating. What is depression? Depression is a mood disorder that can cause feelings of sadness, hopelessness, and emptiness. It can also lead to physical symptoms such as fatigue, changes in appetite, and sleep disturbance. Depression can be mild or severe, and it can last for weeks, months, or even years. Symptoms of anxiety and depression. While anxiety and depression are separate disorders, they often occur together. Some common symptoms of anxiety and depression include feelings of sadness or emptiness, loss of interest in activities, feelings of worthlessness or guilt, irritability or restlessness, difficulty concentrating or making decisions, changes in appetite or weight, fatigue or lack of energy, sleeping too much or too little, physical symptoms such as headaches or stomach aches, thoughts of suicide or self-harm. Causes of anxiety and depression. The causes of anxiety and depression are complex and can vary from person to person. Some common factors that contribute to these disorders include genetic factors. Research has shown that genetics can play a role in the development of anxiety and depression. Studies have found that people with a family history of these disorders are more likely to develop them themselves. This suggests that there may be a genetic component to these disorders. Brain chemistry. The brain chemicals, neurotransmitters that regulate mood, such as serotonin, dopamine, and norepinephrine, can also play a role in the development of anxiety and depression. When these chemicals are imbalanced, it can lead to mood disorders. Environmental factors. Stressful life events such as trauma, abuse, or the loss of a loved one can trigger anxiety and depression. Chronic stress at work, school, or home can also contribute to these disorders. Medical conditions. Certain medical conditions, such as thyroid problems, chronic pain, or heart disease, can increase the risk of developing anxiety and depression. Life events and trauma. Life events such as trauma, abuse, and loss can also trigger anxiety and depression. These events can cause a person to feel overwhelmed, helpless, and hopeless. They can also lead to changes in brain chemistry and function. Practical tips for overcoming anxiety and depression. While there is no one-size-fits-all approach to treating anxiety and depression, there are several practical tips that can help alleviate symptoms and improve overall well-being. Here are some of the most effective strategies. Mindfulness meditation. Mindfulness meditation is a technique that involves focusing on the present moment and accepting thoughts and feelings without judgment. Research suggests that regular mindfulness meditation can reduce symptoms of anxiety and depression, as well as improve overall mental health. Exercise. Exercise is a natural mood booster that can reduce stress and anxiety. Even a small amount of physical activity each day can have significant mental health benefits. Aim for at least 30 minutes of moderate exercise most days of the week. Good sleep habits. Getting enough restful sleep is essential for good mental health. Poor sleep habits can exacerbate symptoms of anxiety and depression. Aim for 7 to 8 hours of sleep per night and establish a regular sleep routine. Social support. Having supportive friends and family members can help alleviate symptoms of anxiety and depression. Reach out to trusted loved ones and engage in activities that bring you joy. Therapy. Therapy can be an effective treatment for anxiety and depression. Cognitive behavioral therapy (CBT) is a type of therapy that can help identify negative thought patterns and teach coping strategies for managing anxiety and depression. Medication. Medication can be an effective treatment for anxiety and depression, especially in severe cases. Antidepressants and anti-anxiety medications can help alleviate symptoms and improve overall well-being. It's essential to work with a healthcare provider to find the right medication and dosage. Healthy diet. Eating a healthy diet can help improve overall well-being and reduce symptoms of anxiety and depression. Aim for a balanced diet that includes plenty of fruits, vegetables, whole grains, lean protein, and healthy fats. Avoid processed foods, sugary drinks, and excessive caffeine, which can worsen symptoms. Gratitude journaling. Gratitude journaling involves writing down things you're grateful for each day. It can help shift your focus from negative thoughts to positive ones, which can improve overall well-being and reduce symptoms of anxiety and depression. Try writing down 3 things you're grateful for each day, no matter how small they may seem. Setting realistic goals. Setting realistic goals can help improve overall well-being and reduce symptoms of anxiety and depression. Break larger goals into smaller, more manageable ones, and celebrate each accomplishment along the way. This can help build self-confidence and motivation. Avoiding negative self-talk. Negative self-talk can contribute to symptoms of anxiety and depression. Challenge negative thoughts and replace them with positive ones. For example, instead of thinking, "I'm never going to be good enough," try thinking, "I'm doing the best I can, and that's enough." Self-care. Self-care is essential for good mental health. Make time for activities that bring you joy, such as reading, listening to music, or taking a bath. Prioritizing self-care can help reduce stress and improve overall well-being. Mindful breathing. Mindful breathing is a technique that involves taking slow, deep breaths and focusing on the sensations of breathing. It can help reduce symptoms of anxiety and depression by promoting relaxation and reducing stress. Try taking 5 to 10 slow, deep breaths when you're feeling overwhelmed. Time management. Poor time management can contribute to stress and anxiety. Prioritize tasks and make a schedule to help manage time more effectively. This can help reduce feelings of overwhelm and improve overall well-being. Graded exposure. Graded exposure is a technique used in therapy to help people confront their fears gradually. It can be an effective treatment for anxiety disorders. For example, if you have a fear of flying, you might start by looking at pictures of airplanes, then progress to watching videos of airplanes taking off, and eventually take a short flight with a therapist or trusted companion. By incorporating these practical tips into your daily routine, you can improve overall well-being and reduce symptoms of anxiety and depression. Remember that seeking help is a sign of strength, and there are many effective treatments available. Conclusion: living with anxiety and depression can be challenging, but there are practical steps you can take to manage symptoms and improve overall well-being. By incorporating techniques such as therapy, medication, and lifestyle changes like exercise, healthy eating, and self-care, you can begin to take control of your mental health. If you're struggling with anxiety or depression, don't hesitate to seek help. Talk to your doctor or a mental health professional to explore treatment options and develop a plan that works for you. So this was our today's video. I hope you all liked this video. Don't forget to hit the like button and subscribe my channel, and also share it with your friends and family. We will be back soon with a new video. Till then, keep supporting and take care.